Hi, everybody. Welcome to week 5. The topic for this week is licensure for respiratory therapist. And this is Professor Forster, and I will be your facilitator this week. So first, let's take a look at what our objectives are. First, we're going to look at the requirements for licensure in the state and the role of the Maryland Board of Physicians. We're going to describe your scope of practice for respiratory care in the state. Also, we're going to list the credentials that you need for a respiratory therapist license and other credentials available to you once you get the basic credentialing that's necessary for licensure. And then we're going to discuss the importance of continuing education once you're a licensed working practitioner. Okay, the Maryland Board of Physicians. This is the agency that can authorize you to practice respiratory care in the state of Maryland. To get your license, you have to fill out an application, and the application is on the Maryland Board of Physicians website. And once you fill out the application, you submit it, you pay your fees, and part of that application process is that you're going to have a background check done, which is done through fingerprinting. Another important aspect of the Maryland Board of Physicians is the Respiratory Standards Committee. This committee is made up of physicians, respiratory therapists, and a consumer member. And their major role is to make sure they respond to any issue that arise for any of the respiratory therapists in the state. They look at any complaints that have been levied by a particular therapist in the state. So they are kind of the part of the Maryland Board of Physicians that are very much a part of respiratory therapy. So here are the requirements. First, you have to be of good moral character, and they decide that by a list of questions on your licensing application. You have to be 18. You have to meet the educational training and examination requirements established by the board. And this here, the board they're talking about, the Maryland Board of Physicians. You have to graduate from an educational program as defined by the board. You have to have certification, or you have to have a credential by a nationally certifying board, which has been approved by the Maryland Board of Physicians. And then you have to demonstrate oral and written competency in English. So what all this means is for the educational training, it's the programs that are accredited by COARC, which we talked about COARC in week 2, and this program is accredited by COARC. We do have a certifying board. It's called the National Board for Respiratory Care. They own and they give you the examination to earn the credential. And if you graduated from an English-speaking school in the state of Maryland, you have demonstrated oral written competencies. The last thing, you have to complete a background check. That's according to this particular statute, which is through the Maryland General Assembly. And to do this, you have to have your fingerprints done. And it doesn't matter if you've had fingerprints done in the past for any reason, say for instance, child care providers, or if you taught in a school, or if you want to own a handgun in the state of Maryland, you have to have your fingerprints. But people don't keep fingerprints for a long time, so you have to redo them. So this will be done on immediate when you're getting ready to apply for your license, which is after you graduate from the program. Now, let's look at the scope of practice. The definition for a scope of practice in any field is procedures, activities, and therapies that you are allowed to perform as a licensed respiratory care practitioner, or licensed respiratory therapist. And this information is found in the Respiratory Care Practice Act, which is part of the Maryland General Assembly. So I have, at the end of the presentation, there's the list of references for all the different organizations that we're talking about today, but I also put the link into the link part of the bright space. So in terms of the scope of practice, in a nutshell, this allows the respiratory therapist to evaluate the patient and their needs, develop a treatment plan, implement that treatment plan, and to assess the patient's response to the treatment and update the treatment plan as necessary. I know in Unit 1 you saw and you looked at the roles in the different therapies of the respiratory therapist. So that's what our scope of practice is. The next couple of 3 slides, it really gives you the specifics from the statute found on the Maryland General Assembly page. I'll kind of leave that to you just to read over for yourself so you get a general gist, but this is the summary of what our scope of practice allows us to do. So we have a pretty wide scope of practice, which is, it's nice. It's a good career to get into because you do have a pretty wide scope of practice that you can do. So remember, one of the requirements for licensure is credentialing. You have to have a credential. And the National Board for Respiratory Care, which is the NBRC, is responsible for this. And what's important to note is the NBRC is actually accredited by the NCCA, which is accreditation, a nationally accredited commission for certifying agencies. So they are part of an accredited institution also. So what's the need for credentials? So here's a direct quote from the NBRC. Credential provide recognition of and for hard work and dedication to quality. Success brings respect among colleagues and instills a sense of pride in those who earn the NBRC badges of distinction, which are you get a badge, or it's electronic badge of the credential you earn. For the same reason, it's, why? For the same reason, all 49 states regulating the profession recognizes NBRC exams as a standard for state license. Sure, the only state right now that does not have a License Practice Act for respiratories is Alaska, and they're working on it. And success requires exceptional knowledge and competency. So the other reason why it's required, you have to be able to demonstrate competency, and one way to do that is taking this national exam. So the credential needed for licensing in the state of Maryland is a Certified Respiratory Therapist, or CRT. The way we get this, you obtain that by taking the Therapist Multiple Choice exam, and that's the exam that the NBRC has developed. It has been validated to show that it really does show what it's supposed to be measuring. And the score to get that CRT credential is an 86 or better. The credential required for licensure is just the CRT, but your goal, since this is what you went to school with, is to obtain and earn the Registered Respiratory Therapist RRT credential. It usually means more money and more access to stepping up on any career ladders that are available at your institution. So the first step on that therapist multiple choice exam that we talked about in the previous slide, you have to score as a 92 or greater on that exam. And if you do that, you're able to take the second exam, which is the clinical simulation exam. It's a separate exam by the NBRC that you have to take to earn that RRT credential. And to be able to sit for any of the exams, especially the CRT, to earn the CRT credential and the RRT credential, you have to be a graduate of a COARC approved program, which this program is a COARC accredited program. Once you have the CRT or the RRT credential, and after you've worked a while, usually a year, you can go on and get specialty credentials, especially if you want to work in NICU, PICU, or pulmonary function. Pulmonary function is an outpatient type setting where you just do diagnostic testing. And the credentials, specialty credential currently available by the NBRC, is the Registered Pulmonary Function Technologist, the Certified Pulmonary Function Technologist, Adult Critical Care Specialist, Neonatal Pediatric Specialist, Sleep Disorder Specialist, and an Asthma Educator. What's nice about getting and obtaining additional credential, they're stackable credentials. And again, it shows that you're competent and you've demonstrated competency in that particular specialty area. And depending on where you work, it may be a requirement to work in those specialty areas. Next, once you get into the profession, you've earned all your credentials that you want to do at the time, you're going to need to continue your education, mainly because the practice of respiratory care is evidence-based. It's based on the evidence currently available to you. And the reason we do that is we want to make sure we provide the best outcomes for the patients, and what we do changes based on the evidence. So in essence, you are a lifelong learner. Also, it's required to maintain your license. Every 2 years in the state of Maryland, we have to renew our license. And to do that, you have to have 16 continuing education units. They're required 16 every 2 years when you renew, and you can get these from any AARC event or an event given by the Maryland DC Society for Respiratory Care. And the AARC is the American Association for Respiratory Care. Also, you need to maintain your MBRC credential. For the MBRC credential, whatever you have, whether it's the CRT, RRT, or a combination of RRT, ACCS, or RRT, SDS, you need to have additional continuing education units in that particular specialty. So you have to have 30 in 5 years for that particular maintain whatever credentials you have. And again, these can come from the Maryland DC Society for Respiratory Care or the AARC. And how do we give them? How? The one thing we can do by attending conferences, in person or webinars. Fortunately, now that we're out of COVID, we're able to do a lot of stuff, a lot of conferences in person. The biggest conference that we will go to in your second year is the Conference by the Sea. So you'll get an idea what the conferences are like. You can do webinars. Some webinars are free on the AARC website. If you're a member, you get invitations from different other vendors for webinars. You can complete any course offered by the AARC. When you go to the AARC website, there's a whole lot of different coursework that you're able to do. And you can retake a credentialing exam. If you want to retake your RRT exam again, you can. You can earn another specialty credential, or the MBRC has quarterly assessment testing that you can do to get this required CEUs that you need both to maintain your license and to maintain your credential. And kind of the last thing that we're going to talk about is continuing your degree from the AAS to go to get a bachelor's degree. Right now, CCBC has an articulation agreement with Towson University. Towson will accept up to 64 of our credits, including the respiratory, all the respiratory credits, including the clinical credits. You're going to earn a Bachelor's of Technical Professional Study, BTPS, in Allied Health. And there's several different concentrations in that general degree, and one of those is Advanced Respiratory Therapy. Here's a screenshot of the Towson University webpage for Allied Health. It kind of tells you what you need to do. You can choose your track. There's administration, management, advanced respiratory, family studies, education, science, professional preparation, and health promotion, wellness, prevention, and community health education. Most of the requirements for each of these specialties are all online, but you'll need to contact the people at Towson to get more information, or you can go right to the website and you can look at what you can find by looking at the website. And like I said, I will provide the websites in direct links to the website in Brightspace. And here are the list of references for everything found in this particular PowerPoint presentation. So thank you for your attention, and I look forward to reading your responses on the discussion board, and have a good day.